Okay.
আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম আসসালাম।
স্যার আগের লেকচার থেকে স্যার কোয়েশ্চেন ছিল দুইটা স্যার।
আচ্ছা, ঠিক আছে, ওগুলা হবে, আগে আমরা এটা শেষ করে নিই। ঠিক আছে,
জি স্যার।
এখনই আমরা শুরু করতে চাচ্ছি তো সেই জন্য।
জি
তা
স্যার।
না হলে হ্যাঁ, ঠিক আছে। তাহলে দেখো, আমরা শুরু করি। তার আগে শেয়ার তো করতে হবে। লেকচার শেয়ারিংটা শুরু করি। এই যে দেখো, কথাটা আমি বলি সবসময়, যে সবাই বলে পেরিটোনিয়াম হচ্ছে একটা সিরিয়াস ব্যাপার। দেখতে পাচ্ছ কিছু? স্ক্রিন শেয়ারিং শুরু হয়েছে, এই যে কি লেখা দেখতে পাচ্ছ?
জি স্যার।
নাথিং সিরিয়াস অ্যাবাউট
স্যার
পেরিটোনিয়াম।
নাথিং সিরিয়াস অ্যাবাউট পেরিটি।
হ্যাঁ, সিরিয়াস তো না, এটা এটা আসলে কি? এটা একটা সেরাস স্ট্রাকচার, এত ভয় পাওয়ার কি আছে? দুনিয়াতে অসংখ্য সেরাস স্ট্রাকচার আছে। There are so many serous structures in our body, so it's another serous structure, that's all. Don't take it so seriously. Okay, it can't bite you, it can do anything to you. So this is very simply a serous structure, that is peritoneum. And by definition, it is a thin, as I've already told you, it's a thin serous membrane that lines the walls of the abdominal and pelvic cavities and cover the organs within these cavities, either partially or fully, you can say it or not. So thing is that it is mainly a serous membrane that lines the walls of the abdominal pelvic cavity. This is the abdominal cavity and this is the pelvic cavity, and that is lined by this red one. It is actually the peritoneum, and covered the organs within these cavities, either partially or fully. If it is fully covering, then it is intraperitoneal, or partially covering retroperitoneal. I'll tell you. That's why they have said either partially or fully. Now, note that the peritoneal cavities and abdominal cavities are not the same. Why? Peritoneal cavities and abdominal cavities are not the same. Can anyone explain me?
Peritoneal means in between two serous membrane, uh, and abdominal cavity means the I mean sir মানে যেই মানে দুইটা মেমব্রেনটা পাশাপাশি আছে, এর মাঝখানে যে স্পেসটা সেটা কভার করতেছে, দ্যাট ইজ নট কন্টেইনিং দ্য সেরাস ফ্লুইড।
Right? Actually,
মানে
two.
অ্যাবডোমিনাল ক্যাভিটিতে অর্গানগুলো বাদ দিয়ে বাকি ক্যাভিটিটা হবে পেরিটোনিয়াল ক্যাভিটি।
আচ্ছা, ভালো বলেছো, এটাও ভালো বলেছো, এক্সক্লুশন মেথডে বলেছো। This is good approach, but thing is that we have to know that what is peritoneal cavity first, then we can say. Before that, we can elaborate the structure, a little amount of structure of the peritoneum. That peritoneum consists of simple squamous epithelium, that is also called mesothelium, over a thin layer of loose areolar tissue. Right. So peritoneum consists of a simple squamous epithelium. Hey, see, this one is the simple squamous epithelium over a thin layer of connective tissue. This is connective tissue layer through which the blood vessels and everything passes, right? So this is the serosa, above it is the peritoneum. This is the connective tissue layer, and this is the peritoneum, and through which the blood vessels and everything pass. So from this figure, you can understand that the peritoneum is a passageway for the viscous to get its blood supply and nerve supply. Because you can see from this figure, very simple figure, but it tells many things. This is the lining epithelium, simple squamous epithelium, connective tissue, and in this connective tissue, we are seeing some blood vessels and also some nerves that will carry the innervation, and that will carry the blood supply to the viscous. Right. So now, from this structure, we can also go a little further regarding the. Is it clear that peritoneum is a passageway for nerves and viscous blood vessels to the viscous? Okay, there are two layers of the peritoneum: parietal layer and visceral layer. As it is always, I've told you the plural there are two layers in the pleura: parietal pleura, visceral pleura, parietal. Similar way, there are two layers in the peritoneum, and as you have rightly mentioned, in between these two layers, actually there is a potential space. Potential space, you know, what is the meaning of potential space? You know it.
Yes,
Potential,
sir. It means
A space
it can
susceptible
expand.
to.
yes. When needed, it can expand, but usually it is not that much evident.
That
Right. So these potential space contains a little amount of fluid, serous fluid, which actually helps in lubrication and the free movement of the viscera within the abdominal cavity. So that is actually the peritoneal space. So peritoneal space is the space between the parietal and visceral layer. That's why it is called peritoneal cavity or peritoneal cavity. The potential space filled with very thin layer of serous fluid. In male, it is closed, and in female, it is open. You know it through the
ovary.
no, not through the ovary. Actually, it is the vagina that carries to the uterus, then uterine tube to the peritoneal cavity. Right? Have you studied the female genital organs?
Not yet.
No, sir.
Not yet. Okay,
Not
fine.
sir.
That's why I'm not going to the detail of it. You just know it, and when you study it, you'll understand that vagina is an opening. Vagina is connected with the uterus. There is an abdominal uterine cavity which passes through the uterine tubes, and the uterine tubes open into the peritoneal cavity. So ultimately, the peritoneal cavity is open to the exterior through the fallopian tube or uterine tube, then through the uterus, then through the vagina to the exterior. But in case of male, it is a closed one, right? That it is been said, but you'll be understanding it when you study the female genital organs in details. Now, extraperitoneal connective tissue is present between the parietal layer of the peritoneum and the abdominopelvic wall. So suppose this one is the abdominopelvic wall. This is the intra-abdominal wall. This is the posterior abdominal wall, and this is the pelvic wall. And this is the parietal layer, and this is the visceral layer of the peritoneum. So what they want to say, and we know that extraperitoneal connective tissue is should be outside this parietal layer and below this abdominal wall, right? So this is the place of the extraperitoneal tissue, and this is actually the peritoneal cavity. And abdominal cavity consists of everything beneath this and anterior and posterior and lateral walls of the abdomen. So it includes the peritoneal cavity, it includes all the peritoneal abdominal organs and pelvic organs. So abdominal cavity contains everything, but peritoneal cavity doesn't contain these retroperitoneal organs. Can you see it from here? They partially cover, but it doesn't contain the retroperitoneal organs. So peritoneal cavity here, it is outside. So retroperitoneal organs are outside the peritoneal cavity, but within the abdominal cavity. Within the abdominal cavity, because it is posterior wall of the abdomen and this is the anterior wall of the abdomen. So everything between these two layers is actually the contents of the abdominal cavity beneath the diaphragm up to the pelvic diaphragm, and all the layers are covered anteriorly, posteriorly, and laterally is forming the abdominal cavity. But peritoneal cavity is only this potential space, right? Okay, next point to note: what are the functions of the peritoneum? First of all, it allows the free movement of the viscera. As I've told you, there are layer fluid in the two layers between the two layers of the viscera, so it helps in free movement of the viscera, like the um, lubricant oil in the cars or motor vehicles. We add some fluid, mobile, that is called lubricant oil, mobile shell, whatever we use, right? BP. So that helps in free movement of the parts of the engine, or else there would be production of huge amount of it, and if the amount of fluid is less, the engine seizes. Similarly, if the peritoneal cavity, the fluid in the peritoneal between the two layers of the peritoneum is reduced or somehow fibrosed, there is fibrosis develops due to any reason, then the viscous can't move freely and we feel pain, we feel problem, right? So long there is free movement due to the presence of the adequate amount of fluid, not too much, not too less, adequate amount of fluid between the parietal and visceral layers of the peritoneum, everything moves freely. And next, very important one, as I've told you and have shown you, that it is a conduit for the blood vessels and nerves. That means it takes the nerves and blood vessels towards the viscera and away from the viscera through this peritoneum. Okay, guards against infection phagocytic cells in the mesothelium. There is huge amount of macrophages, huge amount of phagocytic cells. I mean macrophages. Mostly they are the macrophages cell. They are present in the peritoneum, and they actually guards against the infection. They just engulf the bacteria, virus, whatever they get, and it nicely wraps the infected area. Because it's a mobile part, it knows where the infection is, it goes there and wraps it very toughly and closely, so that the infection can't spread to other areas of the abdomen, right? And surface area for absorption, this is very important. For, there is dialysis, there the process of dialysis, where artificially the uh, kidney's function is done, because the kidney is a major excretory organ. When the kidney fails, then there are two kinds of it. Is hemo That is by blood, they take out the blood by a machine and clear up by the dialysis machine and returns the blood to the body. And another is hemodialysis, and another is peritoneal dialysis, because the peritoneum is also a huge surface, and it absorbs many things, and that excreta that is metabolically waste materials are not allowed to be absorbed. And that's why, if you change the peritoneal fluid repeatedly throughout the day, it is likely that all the metabolic waste materials would be coming out by this dialysis fluid that is inserted into the peritoneal cavity. But that is a clumsy process. But if it is not possible to do the hemodialysis, then peritoneal dialysis remains an option for some of the patients. When what they do, they usually put some 10 or 20 liter, 15 liters of peritoneal fluid throughout the day and drain out the fluid. It is continuous process is going on, and the washing of these fluid actually reduces the amount of metabolically metabolic waste materials from our body. And it is a storage house of the fat. That is very important. That is for what the storage of fat was originally designed to for the survival of the species. That's why, female of all the female female of the human or other species have got more fat in their body. That's why they can withstand starving better than male partners or male structures, male. Yeah. So that is the storage of fat. That is the target of the storage of the fat for the survival of the individual. So these are in short the functions of the peritoneum, and we should know at least these very important things: free movement of the viscera, conduit for the blood vessels, guards in infection, and wrapping, surface area absorption, storage of fat. You can remember. Okay, fine. But these are the must things you must know. And it's easy to remember that there is a huge amount of fat in between the layers. Now, two terms I've told you: intraperitoneal, retroperitoneal. What do they mean? Intraperitoneal means that the organ is fully within the two layers. This is the parietal layer and this is the visceral layer. So within the two layers of the peritoneum, actually the organ is fully covered by the visceral peritoneum, and the parietal is, so it is called intra, within the peritoneal, intraperitoneal. But some of the organs are originally outside. From beginning it is outside, like kidney, like the suprarenal gland, ureters, These are originally, that is why they are called primary retroperitoneal. They are partially covered by, but posterior surface is free from the covered part of the peritoneum. So these are originally, and these are called primary retroperitoneal organs. But some of the organs like the pancreas, except the tail, and the duodenum, except the initial 2 centimeters, right? These things are actually, initially they were wrapped by the peritoneum in all the sides, but due to zygosis, a process called zygosis, I'll show you what is zygosis. The, you know it, zygosis?
No, sir.
Hey, therefore this is the process of zygosis. Say for example it is the duodenum, right? That tube, say you take it as the duodenum, mesentery as it is, then you see now it is, initially it was fully covered by peritoneum in all the sides. But what happened? It fell on the parietal layer. This is the visceral layer, and this is the parietal. Red one is the parietal layer, and the blue one is the visceral layer. So it falls upon, and these parietal visceral layer is fused with the parietal layer, and ultimately now it is open behind. There is no peritoneum behind, right? So it becomes retroperitoneal, and this process leads to formation of some of the retroperitoneal organs like the pancreas, except the tail, the duodenum, and except the initial 2 centimeter ascending colon, descending
colon
colon,
descending.
right, cecum and rectum in the
স্যার
upper 2/3.
স্যার
These are,
প্যানক্রিজের টেল কি রেট্রো পেরিটোনিয়াল হবে?
না,
না 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 হবে না তো, এক্সেপ্ট বললাম তো, এক্সেপ্ট দ্য টেল।
মানে এটা ফ্রি থাকে না?
হ্যাঁ, ফ্রি থাকে উইদিন দ্য
ও আচ্ছা।
লিনোরেনাল লিগামেন্ট। হ্যাঁ, তাহলে
স্যার
এই,
এই লিনোরেনাল লিগামেন্টটাই কি, এটা জানতে চাইছিলাম আর কি আগে।
আচ্ছা ঠিক আছে, এটা আমি পরে, একটু পরেই বলবো তোমাকে, তোমাদের সবাইকেই বলবো। ভালো প্রশ্ন করেছো, লিনোরেনাল লিগানটা একটু আসলে বোঝার দরকার আছে, এগুলি কোত্থেকে আসে। তাহলে এই হচ্ছে কি, এইভাবে বাই দিস প্রসেস অ্যাকচুয়ালি সাম অফ দ্য retroperitoneal organs are located finally. So this is called zygosis. And some of the, as I've told you, some are initially from the beginning they are retroperitoneal. They are always behind the peritoneum, like the kidneys, the ureters, and the suprarenal glands, right? So altogether, these are the retroperitoneal organs. Okay. Now, developmentally, let us, এই যে এখনই তুমি উত্তর পেয়ে যাবে ধীরে ধীরে, তুমি লিনোরেনাল লিগামেন্ট যেটা বলছিলে। Say in the thoracic cavity, there are two major cavities. One is the pleural cavity, one is the pericardial cavity. Let us consider about the pleural cavity. You know, the lung bud is enlarging into the peritoneal, the pleura, and it is pressing, and finally it is forming a two-layered structure. The parietal layer, which is away from, and the visceral layer is covering the lung, right? এক মিনিট, হ্যাঁ, আমি একটা ইম্পর্টেন্ট ফোন ধরছি, জাস্ট 1 সেকেন্ড। হ্যালো, আসসালামু আলাইকুম। সরি, এক্সট্রিমলি সরি। একটা ভেরি ইম্পর্টেন্ট কল দ্যাট আই ডোন্ট অ্যাকচুয়ালি রিসিভ, কিন্তু এটা না করে পারছিলাম না। আই কুডন্ট বাট রিসিভ দ্য কল। সরি, এক্সট্রিমলি সরি। পরে মানে আমার এক আত্মীয় এখন মারা গেলেন, এই মাত্র সেই খবরটা পেয়েছি। হ্যাঁ, তো হ্যালো, তোমরা কি আছো লাইনে? আর ইউ উইথ মি?
Yes, sir.
Yes, sir.
আচ্ছা,
Yes,
আহ,
sir. You can continue.
হ্যাঁ, আচ্ছা ঠিক আছে। তাহলে সরি, এক্সট্রিমলি সরি, মানে রিসিভ না করে পারছিলাম না। এখন আমরা কোথায় ছিলাম? আমরা কোথায় ছিলাম ক্লাসের? এটা কোথায় গেল? এক সেকেন্ড লাগবে বোধহয় এগুলোকে ঠিক করতে।
লাংসের ছবিগুলো ছিল।
হ্যাঁ হ্যাঁ, আচ্ছা ঠিক আছে। হ্যাঁ, তাহলে দেখো, বাট this is only one organ here, like the lung or the heart in the pericardial cavity, and that makes the very simple arrangement. But in case of abdomen, there are so many organs within one cavity of peritoneum. Here in the pleural cavity only lung, in the pericardial cavity only the heart, but here in the peritoneal cavity there is stomach, duodenum, jejunum, that is coils of intestine, the genital organs, the urinary organs, many things are within, and spleen, and all these adds a bit more complication. Finally, the arrangement is very much complicated. But if we follow the how this final arrangement is achieved, then it is easy. Let's start with this one. This is the stomach, and this is the abdominal wall, and this is the small intestine. This is ventral mesogastrium. You know, initially it is a straight tube, then it rotates. The rotation of the gut you have studied or you'll study, and this is the ventral mesogastrium. So ventral means in front, and dorsal means behind. So in front of the stomach there is a fold of peritoneum that is called ventral mesogastrium, and behind that is called dorsal mesogastrium. It turns, and now this is the ventral mesogastrium, and this is the dorsal mesogastrium, and these are two kidneys, and you can see the kidneys are always behind the peritoneal cavities, and that's why they are called primary retroperitoneal organs. Now let us add two more organs, the liver and the spleen, to this picture, and now see it is becoming complicated. Now liver has entered into the ventral mesogastrium and spleen into the dorsal mesogastrium. Now you can see the picture is getting complicated by the presence of the liver, then the stomach, then the spleen, then the kidney. So linorenal, gastrosplenic, this is the dorsal. In the dorsal mesogastrium, as these dorsal spleen is accommodated within the dorsal mesogastrium, it could be the modifications, the linorenal ligament and gastrosplenic ligament. The spleen to the stomach is called gastrosplenic, and from the lino means spleen, and renal to renal. So from the lino means spleen to the renal, that is called linorenal ligament, right? So this is how actually the abdominal organs are adding more and more complicacy to the peritoneal foldings, but we will follow one by one eventually, and it would be very easy for us to understand. Next, same thing, let us elaborate. This is the ventral mesogastrium, and this is the dorsal mesogastrium, and you can see the spleen is located within the dorsal mesogastrium, and the liver is located within the ventral mesogastrium, and eventually the ventral mesogastrium give rise to right and left triangular ligaments of the liver, super 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 superior or inferior layers of the coronary. That means the triangular ligaments and coronary ligaments of the liver. You know it because I've shown you in details how the coronary ligaments and triangular ligaments are formed from the diversion of the falciform ligament. I have shown you, right? Then the falciform ligament itself, the falciform, why it is sickle shaped, that's why it is called falciform, which attaches the anterior border of the liver to the anterior superior border of the liver surface to the anterior abdominal wall, and the lesser omentum. We must not forget about this one, the lesser omentum. So these are four things that are derived from the ventral mesogastrium. This is a common
Superior and inferior layer.
inferior layers of the coronary ligament, superior and inferior layers of the coronary ligament, right and left triangular ligament, falciform ligament, and lesser omentum. These are derived from the ventral mesogastrium. And the dorsal mesogastrium gives rise to four more things. The gastrophrenic ligament, gastrophrenic, that means from stomach to the diaphragm. Gastrophrenic, then gastrosplenic, from stomach to the spleen. Linorenal, from the spleen to the kidney. There is kidney behind, so it is not shown here, but there is a linorenal ligament, and the greater omentum. So derivatives of the dorsal mesogastrium are these four ligaments: the gastrophrenic, gastrosplenic, linorenal, and greater omentum. Derivatives of the ventral mesogastrium are four: right and left triangular ligament, superior and inferior folds of the layers of the coronary ligament, falciform ligament, and the lesser omentum. Now you can understand why, when we have studied the porta hepatis, we always said that it is attached, the right side is attached with the lesser omentum, because you see this is the lesser curvature of the stomach and this is the greater, and you know the greater omentum is attached to the greater curvature and the lesser omentum is attached to the lesser omentum on one side, and the other side it is related attached to the porta hepatis. I have told you and you have seen it. So this is how the uh, the peritoneum gets folded due to the adding of more and more organs. It's not a single organ which is rotating. Many organs are rotating. You just can imagine if we put something in a jacket. Say I always give the example. If I put a balloon, put my finger into a balloon, then I try to rotate it, then put another finger, then I try to rotate it in other way, other direction, another one, and another direction. Ultimately, the balloon would be in very complicated one situation, but that can accommodate. If the balloon has got an enormous potential to accommodate all these structures, it can. Similarly, peritoneal cavity is like that. It was initially a cavity where one, second, third, fourth organ was introduced and rotated according to its need, and ultimately all the folds were formed. You can see the ultimate picture is like this. The same picture I have shown you. Similarly, liver, then the lesser omentum, then the stomach, then the greater, that is the gastrosplenic ligament, and this is the linorenal ligament, that is from the spleen to the kidneys, and gastrophrenic is actually not shown here, from the stomach to the diaphragm. So this is
স্যার আগে
how
তো স্যার আমরা পেরিটোনিয়ামে ছিলাম না, তারপরে মেজোগেস্ট্রিয়ামে কেমনে চলে গেলাম?
মেজোগ্যাস্ট্রিয়ামে কি হয়ে গেলা? আচ্ছা,
জি
ভেরি
স্যার।
গুড। ওই যে আমি তো বলেছি যে এগুলা তো হচ্ছে পেরিটোনিয়ালের যে ফোল্ড গুলা, একটা অর্গান দিয়ে আমি তোমাকে বোঝাচ্ছি যে স্টামাকের যে ডেভেলপমেন্টালি যে ফোল্ড, পেরিটোনিয়ামের যে ফোল্ডটা, হ্যাঁ, তোমরা এই পেরিটোনিয়ামের যে ফোল্ড, স্টামাকটা যেমন ধরো যে ধরো লাংটা যেরকম করে ঢুকলো, লাংটা যখন ঢুকলো হাইলাম অফ দ্য লাং এর মধ্যে দিয়ে, একটা অর্গান দেখে ওইটা নিয়ে আমরা কথা বলতে একটা দিয়ে হয়ে যাচ্ছে। দ্য হাইলাম অফ দ্য লাং দিয়ে যে ঢুকলো, লাং বারটা ঢুকে উইদিন দ্য প্লিউরাল ক্যাভিটি এটা এক্সপান্ড করে গেল। সিমিলারলি আমরা যদি কল্পনা করি, ইফ উই কনসিডার দ্যাট দ্য স্টামাক হ্যাজ এন্টার্ড ইনটু দ্য পেরিটোনিয়াল ক্যাভিটি, ঢুকার পথে সাথে একটা ফোল্ড, ইট উইল ক্যারি আ ফোল্ড অ্যালং উইথ ইট, তাই না? এমন যদি হয় এটা ক্যারি করতে, উইট হ্যাজ স্টার্টেড ফ্রম ইটস জার্নি and in midway it is there, and there is a fold in front which is attached to the anterior abdominal wall, and another fold is to the posterior abdominal wall. এরকম একটু চিন্তা করো, এটা হলো কি ভিসরাল লেয়ার, আর দূরে যেটা থাকবে সেটা হচ্ছে প্যারাইটাল লেয়ার। এখন বুঝতে পারছো, এই যে এইটা হচ্ছে গিয়ে ভেন্ট্রাল মেজোগ্যাস্ট্রিয়াম, এইটা হচ্ছে ডরসাল মেজোগ্যাস্ট্রিয়াম নাম ইনিশিয়ালি। তারপরে এইটার থেকে
ফোল্ডিংটা না স্যার?
হ্যাঁ, ফোল্ডিংটা
ও
মানে
জি স্যার।
একদিক থেকে ঢুকবে, তো ঢুকতে গেলে তার সামনে একটা ফোল্ড থাকে, যে আঙুল। If you put your finger into the balloon, definitely it will carry some part of the balloon in front, and if you can imaginarily can think that the finger has got into the balloon, and now it is detached from your hand, it is remaining within the finger, that is a balloon, then it would be having some posterior end to connect it, and it would be hanging within the balloon. If I can put something into the balloon, not, don't consider your finger because you don't want to cut it, Just consider something, you have inserted a thing which can push into the balloon, then it has already entered into the balloon, then it will be having some part attaching it to the front and some part to the back. The front part is, say, the ventral mesogastrium, and back part is the dorsal mesogastrium. In this way, right? এটা চিন্তা করো। এখন কথা হচ্ছে যে types of folds. How many types of folds are there? Mesentery, omentum, and ligaments. Mesentery means which holds the intestine, or colon, mesocolon, small intestine, and which holds the mesocolon is called mesocolon. Colon ke jeta, the large intestine, that is called mesocolon. Similarly, omenta are the folds, lesser omentum, greater omentum, which holds the stomach, which are related to the stomach, and mesentery is related to the small intestine, mesocolon is related to the large intestine, and ligaments are the folds of peritoneum, which actually holds the other parts of the intestine with the abdominal cavity, abdominal wall, or with the stomach. এরকম এগুলোকে বলা হয় ligaments, যেমন gastrosplenic ligament. So spleen is attached to the stomach by this fold. That's why it is called gastrosplenic ligament. This is actually fold of peritoneum, the parietal peritoneum. Sorry, visceral peritoneum. Parietal to dure, এই যে parietal to dure. Visceral peritoneum is folded. Parietal to কোনো folding হয় না. Visceral is folded. So the folds of the visceral peritoneum which holds or attaches other parts of the other organs with the stomach or the abdominal wall are called ligaments. The folds of the peritoneum holds the stomach with other structures are called omentum. In this way, the lesser omentum and greater omentum is also formed. And mesentery are the folds of the peritoneum which holds the small intestine. Mesocolon are the folds of the peritoneum which holds the large intestine. Right? Now you understand কি হয়ে আসলো mesogastrium, dorsal and ventral mesogastrium. These were the developmental terms. Now we don't have the dorsal mesogastrium, ventral mesogastrium. We don't have them. We have lesser omentum, we have greater omentum, we have the falciform ligament. These we have now. There is no ventral mesogastrium or dorsal mesogastrium in adult body, right? এই জন্যই আমরা এখন আর খুঁজে পাই না এটাকে। বুঝতে পেরেছো?
জি স্যার।
হ্যাঁ, আচ্ছা, এখন আসো
স্যার, একটা কোশ্চেন।
হ্যাঁ হ্যাঁ বলো।
স্যার, আমাদের বডিতে তো অনেক জায়গায় লিগামেন্ট আছে, যেমন দুটো বোনকে কানেক্ট করতে লাগে, তো ওই লিগামেন্ট আর এই লিগামেন্টের মধ্যে কি পার্থক্য আছে নাকি একই ধরনের?
অনেক পার্থক্য আছে।
Peritoneal fold.
ভেরি গুড কোয়েশ্চেন, ভেরি গুড কোয়েশ্চেন। এরকম প্রশ্ন করলেই ভালো লাগে। দেখো, অনেক সময় আমরা একই ধরনের, we use the same kind of words but the meaning is same but application is different. Like those of the ligaments in the extremities we have studied, the ligaments are the connective tissue which join attaches one bone with another bone, right? Here the same thing, it is a connective tissue because serous layer is covered by the mesothelium, but inside it is full of connective tissue, as I've shown you in the structure, right? So you can consider these folds as layer of connective tissues which is covered on its side by the thin layer of mesothelium or simple squamous epithelium. But actually the main content of the folds of the peritoneum are formed by connective tissue. In that way they have related the terms, and they have applied these terms only to those situations where the other organs are attached either to the stomach or to the posterior abdominal or abdominal walls. কিন্তু তোমার প্রশ্নটা ভেরি গুড কোয়েশ্চেন, যে সেম কিনা, মানে স্ট্রাকচারালি তো সেম, কিন্তু ওখানে শুধুই হচ্ছে কানেকটিভ টিস্যু, আর এখানে হচ্ছে অন ইচ সাইড অফ দ্য কানেকটিভ টিস্যু লেয়ার টিস্যু দেয়ার ইজ এ থিন লেয়ার অফ সিম্পল স্কোয়ামাস এপিথেলিয়াম, সেই জন্য বলা হয়েছে, কিন্তু অ্যাকচুয়ালি দুইটা একটু আলাদাই। এটা হচ্ছে পেরিটোনিয়াল ফোল্ড আর ওটা হচ্ছে ট্রু একদম টিপিক্যাল, that is typical connective tissue, and this is connective tissue covered by simple squamous epithelium. ঠিক আছে? কিন্তু
থ্যাংক ইউ স্যার।
আচ্ছা, এখন আসো যে এটাতে দুইটা বড় বড় স্যাক হচ্ছে, one is greater sac, this one is the greater sac, and this blue one is the small lesser sac, and two omenta are there also. This is lesser omentum and this is the greater omentum. আমরা এগুলো জানবো, এগুলো কি জিনিস, কিভাবে তৈরি হচ্ছে না হচ্ছে, এগুলো খুব ইজি। যে গ্রেটার স্যাক, লেসার স্যাক, গ্রেটার মোমেন্টাম, লেসার মোমেন্টাম কি জিনিস আমরা সবই বুঝে যাব। We will be gradually understanding these things. But you see from these figures, the greater sac is in front of the stomach, and it is covering actually almost all the areas of the abdominal cavity. But lesser sac is behind the stomach, right? এই দেখো ছবিতেই দেখা যাচ্ছে এখানে থাকছে, এবং এইটুকু শুধুমাত্র, only this part is the lesser sac, that's why it is called lesser sac. And এই greater amount কেমন করে তৈরি হয় will be telling you। তার আগে আমরা দেখি, এখন দেখো, you see from other view how small the lesser sac is in comparison to the greater sac। এটাতে কিন্তু দেখে অতটা বোঝা যায় না, মনে হচ্ছে যে আচ্ছা ঠিকই তো, it is a greater sac, it is lesser sac, when actually see this one is the lesser sac, very small one. This is the location of the liver, and from here you can also see the what parts of the colon or intestine or GI tract are retroperitoneal. This is the ascending colon, this is the transverse colon, this is the descending colon, this is the sigmoid colon, attachment root of the sigmoid colon, and only this part is the lesser sac, and this whole thing is the greater sac. And within these sacs actually these are the spaces, but these vacant areas are for the viscera, right? So আমরা দেখতে পাচ্ছি actually we can see the extent of the lesser sac is so small, duodenum, and this is the we'll see, and this is the lesser sac behind the stomach, and this is the greater sac। Okay, কত বড়, see how big it is, now you can understand, and how complicated it is as well. But don't be confused, we'll be very easily understanding it when one more thing, when we will be seeing the vertical and horizontal disposition, we'll come to that. Before that, epiploic foramen, this is epiploic foramen, additas between the greater and lesser sac. Additas means opening or passage between the greater and lesser sac. If you see it, this is how the greater sac and lesser sacs are continuous with each other. You can see this is the how this is the greater sac and this is the lesser sac, and you can see there is a communication between these two, and that is epiploic foramen, through which actually surgeons get access to the lesser sac, greater sac, through the these it is bounded above by the caudate process of the liver, and below by the first part of the duodenum, posteriorly posteriorly by the inferior vena cava, and anterior by the free margin of the lesser omentum, which contains the bile
Hepatic
duct,
artery.
hepatic
Bile
artery,
duct.
and the portal veins. So this is the additas through which actually surgeons put their fingers and ligates the contents here, and then they get to the callus triangle to needed to reach the cystic artery and all the structures to ligate them, and they do the surgeries in the biliary tract, like the gallbladder or the bile duct or whatever they need to. So this is a very important thing for the surgeons, and they must know where is the exact location of the epiploic foramen, or else they would be missing it and they would not be able to reaching that structures। এই জিনিসটা জানতেই হবে, এবং এটা very common in the exam, it is asked about। আচ্ছা, তাহলে দেখো, এখন আসো, এইটা বুঝলে তোমাদের সব প্রশ্নের সমাধান হয়ে যাবে। vertical disposition of the peritoneum and horizontal disposition of the peritoneum, এটা বুঝলে দেখবে যে সব কিছু শেষ। এই একটা ছবি খুব জটিল মনে হচ্ছে, is it seeming to be very much complicated?
Yes, sir.
No, it's not, it's very easy। Let us start from here, let us start from the anterior abdominal wall at the umbilicus. This is point 1, this is the visceral layer, yes, this is peritoneum that goes upwards and goes all the way back to the posterior surface of the liver, then it turns and superior surface and anteriorly to reach the inferior border of the liver, then it goes backwards through over the visceral surface of the liver, and at the porta apparatus it goes directly into the ligamentum venosum, and then goes to the depth of this fissure, then it turns upon itself to become the anterior layer of the lesser omentum. Now you see this is the lesser
Yes.
omentum. It becoming the anterior layer of the omentum, and when it reaches the lesser curvature of the stomach, it goes all the winds around. এটা একটু খেয়াল করে, এটা একটু ভালো মতো খেয়াল করে, এই জায়গাটাই একবার বুঝলে আর কোনোদিন পেরিটোনিয়াম নিয়ে কোনো কনফিউজ। এটা আমি ইন্দারবীর সিং থেকে নিয়েছি। I have taken it from ইন্দারবীর সিং. It is not in the Vishram Singh or any other book. Very nice thing and very simple way to understand peritoneum. এইটা যদি আগে বলি তাও তোমরা বুঝতে এত কিছু, কিন্তু আগে আমি বলি না। I didn't tell it earlier, but এখন দেখো, আমার মনে হচ্ছে নেক্সট ক্লাস থেকে আমি এটি আগে বলবো, তাহলে অনেক কিছু সহজ হয়ে যাবে। এই দেখো, then it runs around the anterior surface of the stomach to reach the greater curvature of the stomach. Then it goes downwards as the anterior layer of the greater omentum.
Greater omentum.
And greater omentum has got 4 layers.
Four
First,
layers.
third, fourth. And this first layer is the first layer.
Continuous with the fourth layer.
Fourth layer, right. Continues as the fourth layer, not as the second layer, not as the fourth layer, and then goes upwards to reach the colon. And it is closely related to the transverse colon, but it doesn't become attached to the transverse colon. Rather, it rounds around the transverse colon and goes upwards to reach the anterior border of the pancreas. Then it rotates around, takes a sharp turn and becomes the anterior layer of the transverse mesocolon. It is becoming the anterior border layer of the transverse mesocolon, and now it turns around the colon to become the posterior layer of the transverse mesocolon, and again goes to the pancreas anterior border. Sorry, again goes to the anterior border of the pancreas. So it is touching 2 times. The peritoneum is touching 2 times the anterior border of the peritoneum, pancreas. Then it is turning and coming, covering the duodenum, the horizontal part of the duodenum. Then it is forming the anterior border of the mesentery. And now it is getting the small intestine and becoming the posterior layer of the mesentery, and again going to the posterior abdominal wall. So it is going 3 times, 1, 2, and 3 times to the posterior abdominal wall. Now it rounds then the curvature of the sacral and lumbar vertebrae. Then it goes over the, in case of female, it is goes over the rectum, and then it is forms the recto-uterine pouch. Then it is goes over the uterus and becomes continuous with the urinary bladder. Then it is goes forwards and again meets this point 1 at the umbilicus, and now it is completed the 1. What about this one then? What about this one, the second and third layer of the greater omentum? How it is formed then? Let us start it from here. The lesser curvature, it's another fold which goes around the greater curvature of the, that is the posterior surface of the stomach, and reaches the greater curvature, becomes the second layer of the greater omentum, and turns around itself to become the third layer, which goes backwards and passes over, then to it doesn't reach the the pancreas. Rather, it goes above the pancreas to reach the posterior abdominal wall, goes high up in the posterior surface of the stomach, liver. Then it goes downwards to reach again the porta hepatis, and eventually it meets the lesser curvature of the stomach. By this way, the lesser sac is formed. So this is the lesser sac, and that one is the greater sac. এখন বুঝতে পেরেছো কিভাবে এই পেরিটোনিয়ামটা কি রকম কমপ্লিকেটেড? এই জায়গাটা বিশেষ করে দিস ওয়ান ইজ ভেরি কমপ্লিকেটেড ওয়ান, কিন্তু আমরা এখন বুঝে গেলাম how the first one becomes fourth and doesn't become the transverse mesocolon. Rather, it wraps around the transverse mesocolon to reach the anterior border of the peritoneum. Then it turns upon itself to become the anterior layer of the transverse mesocolon, turns around the colon to become the posterior layer of the transverse mesocolon, again goes to the anterior border of the body of the pancreas, and then it turns to go over the duodenal horizontal part and becomes the anterior layer of the transverse anterior layer of the mesentery, wraps around the intestine, small intestine, goes back again to the post-abdominal wall, then it covers all this way. এই জায়গাটা বুঝলে তো এখন, তাহলে এইভাবে অ্যাকচুয়ালি পেরিটোনিয়ামটা in this way peritoneum actually covers all the structures. It is accommodating the stomach, it is accommodating, now it is accommodating the liver, the pancreas, the small intestine, the large intestine, the rectum, all the structures are now being accommodated within the folds of the peritoneum. This is called the vertical disposition of the peritoneum. Now about the transverse disposition of the peritoneum. Transverse disposition of the peritoneum is very simple. There are three actually. One is above the umbilicus, one is below, and what is at the near to the thoracic cavity. That is the what rib cages. The disposition is different. You just follow it from one side. It goes anyone you can follow, and it is very easy to understand. This is the transverse disposition, right? So same thing, one is vertically, one is transversely disposed and getting all the coils of intestine and all the structures here. So you can see transverse section through abdomen a little below the duodenum to show reflection of the peritoneum. So at the level of the duodenum, it is the disposition is like this. Transverse section of the abdomen at the level of the pylorus to show the peritoneal reflection. And this is the stomach. So at the level of the pylorus, this is how they are accommodating the stomach. Same thing. It is at the stomach, it is the duodenum. So this one is higher, this is one is the lower section. Same, right? এটাই বোঝা যাচ্ছে। কিন্তু যেটা বুঝতে হবে এই ছবিটা, peritoneal folds below the umbilicus. I've told you in the first class that below the umbilicus there are 5 peritoneal folds. One is median umbilical fold, 2 medial umbilical folds,
fold,
and lateral umbilical folds.
lateral umbilical fold.
এই দেখো সেই জিনিসটাই। This is the median umbilical fold which contains the urachus, obliterated urachus, and these two are the medial umbilical folds which contains the
obliterated umbilical artery.
And these two are lateral umbilical folds which contain inferior epigastric artery and veins. Similar way, this is the median. এখন বুঝেছো? খুবই এই যে এইটাই, এইগুলা আসলে না ছবিগুলো যদি কোরিলেট করো, এই ছবিটা আমি তোমাদের দেখিয়েছিলাম না, দেখাতে পারি নাই বোধহয়। So this median umbilical fold is attached to the umbilicus and one is to the apex of the urinary bladder. You know it if you have studied it, or if you have not yet studied urinary bladder, then when you will study you will find it in details. কিন্তু এই ছবি দুটো কম্পেয়ার করো, একদম সেম। এই ছবিটা এই ছবিটা একদমই সেম। এখন আসো, আমি যদি রোটেট করে দিতাম এই ছবিটাকে তাহলে আরো ভালো হতো। এই ছবিটাকে রোটেট করলে আম্বিলিকাসটার সামনে, এখানেও আম্বিলিকাস ইজ ইন ফ্রন্ট, তাহলে আরো ভালো হতো। এনিওয়েজ, এখন আসো সাম ক্লিনিক্যালি ইম্পর্টেন্ট peritoneal space বা intraperitoneal space, দুইটা তো পারতেই হবে। One is retroperitoneal pouch of Douglas and a hepatorenal pouch of Morrison's. এই দুইটা জিনিস জানতেই হবে। The nature of fluid is to follow the gravity and to be deposited or located in the deepest part, তাই না? এটা তো you know it. It is the nature of the fluid. So if in his recumbent position, semi-prone position, the most dependent part becomes the retroperitoneal pouch of Douglas. What is the retroperitoneal pouch of Douglas? You can see from this figure. This is the retroperitoneal rectuiterine pouch of Douglas. Rectuiterine pouch of Douglas. That means this is the rectum and this is the uterus. So in female there is a space, this pouch of Douglas. It is called pouch of Douglas, and this is very important clinically. Why? Because when the patient is kept in such position, you can see all these fluid are accumulated here, and even during the surgery the fluid is accumulated here. So maybe you have done the surgery very nicely, but there is a bleeding and that blood has been accommodated here in the rectuiterine pouch of Douglas, but you have not yet without clearing this rectuiterine pouch of Douglas, you have closed the abdomen, right? So during surgery some blood has been collected here and you have closed the abdomen, cleaned these areas, uterus and everything, but you have not cleaned the rectuiterine pouch of Douglas. What will happen? These blood will be and ultimately there would be peritonitis developing from here. So as a surgeon, during any surgery, particularly in female, you have to clean up the rectuiterine pouch of Douglas. Similarly, Morrison's pouch is the hepatorenal pouch between, I've shown you in when I've told you about the liver. There's a space between the liver and the kidneys, because you know the posterior the visceral surface of the kidney is related, the visceral surface of the liver is related to the kidney, right kidney. So in there is a space, and here there
Right,
also,
subhepatic recess.
right, then there is also chance of collection of fluid. So these spaces should be kept in mind. And another thing, recess. There are some recesses in the peritoneal cavity or intraperitoneal recess. These are due to the fold of the peritoneum, and when some part of the intestine is caught here or here, it becomes very problematic and surgical problem. And these are called some races. And intraperitoneal races are very important to know, because as I've told you, and what are the locations of these races, we must know. The most important and the largest one is the lesser sac. Lesser sac is a races. Actually, it's a races. Why? Because it is a cavity between the big liver in front and big stomach behind. So something can be caught there, caught in between these space. Again, there are some duodenal races related to the duodenum, and there are some recesses in relation to the cecum, like this retrocecal races, the superior ileocecal races, the inferior ileocecal races, and these races can lodge some part of the intestine, and when it is lodged within this badly, it is causing intussusception, and it is causing some obstruction of the intestine or GI tract, and that is a surgical problem. Similarly, there might be some races in the mesenteroparietal races, then the retroduodenal races, paraduodenal races. That these are related to the duodenum, and these races can contain, as I've told you, some part of the intestinal loops, and that may also cause similar problem. So these, as a surgeon, we must be cautious about these recesses. During surgery, we must check it whether any part of the intestine or has been lodged within that. Or when a patient comes to you with abdominal pain, you must be aware, we must be aware to about these recesses, right? এগুলো হচ্ছে গিয়ে for these are for the would be surgeons. For would be gynecologists, the retroperitoneal pouch of Douglas is very important for the would be gynecologists, because if you miss it, you might be having a
স্যার
bad
কোশ্চেন ছিল
sure বলেন।
স্যার অ্যাসাইটিস এর টাইমেও কি স্যার রেক্টো ইউটেরাইন পাউচ অফ ডগলাস সাসেপ্টেবল টুয়ার্ডস ফ্লুইড অ্যাকোমোডেশন এক্সেসিভ ফ্লুইড অ্যাকোমোডেশন ইউটেরাইনাল পাউচ
অফ কোর্স ওখানে হয়েই তো উপর দিকে যাবে। ভেরি গুড কোয়েশ্চেন। এটা তো মানে এটা যদি মিনিমাম স্মলেস্ট অ্যামাউন্ট অফ ফ্লুইড, ইফ ইট ইজ সাম ফ্লুইড ইজ কালেক্টেড, it is collected in the retroperitoneal pouch of Douglas, and ascites is huge collection, so it is filled up, then it goes upwards. হ্যাঁ, ঠিকই বলেছো যে এটা তো হতেই হবে, এমন না যে অ্যাসাইটিসের সময় it will be sparing the retroperitoneal pouch. It will be filled up first, then it would be filling the other parts of the abdominal cavity, right? ঠিকই বলেছো। আর কিছু কে যেন বলেছিল দুটো প্রশ্ন আছে, হ্যাঁ আর কি যেন বলেছিল প্রশ্ন আছে আমাদের তো তাহলে
মাইক্রোস্কোপিক স্ট্রাকচার অফ লিভার কি পড়তে হবে অ্যানাটমিতে, ওইটা দেখানো হয়েছিল না আর কি।
ও আচ্ছা আচ্ছা, মাইক্রোস্কোপিক স্ট্রাকচার বলতে বোঝায় হিস্টোলজি। হ্যাঁ, ওটা তো ম্যাডাম পড়াবেন। হ্যাঁ
ও আচ্ছা,
ওটা ম্যাডাম পড়াবেন একদম, এবং খুব সুন্দর করে পড়াবেন। এবং এটা কিন্তু লিভার, আমি একটা কথা সবসময় বলি, মানে এটা আসলে তোমাদের সাথে এইবার আর হয়ে উঠলো না দুর্ভাগ্য, যে দুইটা স্ট্রাকচার হিস্টোলজির হচ্ছে গিয়ে মানে ইউ মাস্ট স্টাডি টু স্ট্রাকচারস অফ হিস্টোলজি ইন ডিটেইলস। ওয়ান ইজ মাসল স্ট্রাকচার, অ্যানাদার ইজ দ্য লিভার স্ট্রাকচার। এই দুইটা স্ট্রাকচার বুঝতে একটু চ্যালেঞ্জ আছে, আর বাকি হিস্টোলজি বুঝতে চ্যালেঞ্জ নাই। একদম ফর্মুলা, ইটস এ ফর্মুলা যে স্টামাক 4 লেয়ার, 4 layers should be there. কি mucosa, submucosa, musculus externa, serosa. Okay, what are the changes in the mucosa? What are the changes in the submucosa? In this way, you can understand, and you would match it with the other parts, and that becomes easy. For GI tract, there are 3 layers in the female that is genital organs, 3 layers in the এই কোন layer কোথায় কোনটা absent, that's very easy formula, just formula. If you know the formula and if you know the general arrangement of the structures, you can easily predict about the histological structure of that particular organ without knowing many things. But you have to visualize the structure of the liver, or else you will not understand anything, because it's a complicated structure. As I've told you, liver is the only organ in our body which the same cell is doing the exocrine function and endocrine function. So its arrangement is very complicated, but if you can understand, it would be giving you a pleasure. Very, yes, I know something about histology now. Similarly, muscle is very important, particularly the structure of the skeletal muscle is very important to understand, because many things depends on the understanding of the, like anesthetist, who would be anesthetist, who would be using the muscle relaxants in the, say for example, orthopedicians or physical medicine specialist or medicine specialist, they would be using the muscle relaxants, and you must know how the muscle is actually working, and for that you must know the histological structure of the muscle. So these two are very tough to understand, but if you can understand, it would give you a very fulfilling pleasure that yes, now I know something about histology. Okay, so I'll tell you that please be attentive when the madam discusses about the histological structure of the muscles, histological structures of the liver. Okay, but for now on, you have the idea of the gross eye structures. So any more question about the peritoneum? You know, let us summarize. Do you have time? Do we have time? No.
No,
No,
sir.
sir. Okay. Do you need to summarize these things? I'll be giving, I can, as it is in the form, কি বলে, PDF, PowerPoint form, I can provide the PowerPoint form in your, okay, আমি দিয়ে দিব এটা, হ্যাঁ, ওকে, এই পাওয়ারপয়েন্টে যেটুকু আছে এইটুকু দিয়ে দিব, বাকিটা পড়বে কিন্তু, হ্যাঁ। কোনো প্রশ্ন আছে পেরিটোনিয়াম সংক্রিয়ার?
স্যার রেসেস গুলো কিভাবে ফর্ম হয়েছে?
রেসেস গুলো হচ্ছে ফোল্ডস অফ দ্য পেরিটোনিয়ামই, হ্যাঁ, কিন্তু স্মলার ফোল্ডস। যেমন কতগুলো তো আছে ফিক্সড, যেমন আছে ওমেন্টাম দিয়ে, লিগামেন্ট দিয়ে, এবং হচ্ছে কি মেজেন্ট্রি দিয়ে কিছু ফোল্ড তো হচ্ছেই, তাই না? দিজ আর ফিক্সড, লাইক দ্য লেসার ওমেন্টাম, গ্রেটার ওমেন্টাম, লিনোরেনাল লিগামেন্ট, এগুলো তো হচ্ছে কি কতগুলো, দিজ আর ফিক্সড ফোল্ডস অফ দ্য পেরিটোনিয়াম দ্যাট উড বি প্রেজেন্ট। রেসেস আর ক্যান বি making out pocketing of the, due to the folding of the peritoneum, and within that pocket some structures get caught, then it is called recess. বুঝেছো জিনিসটা? আর ওগুলো
Yes, sir.
ওগুলো হচ্ছে ফিক্সড, ওগুলো সবসময়ই থাকবে, এগুলো হচ্ছে যখন তৈরি হবে তখন আটকে ফেলবে। আচ্ছা ঠিক আছে, আচ্ছা ঠিক আছে, তাহলে কি ক্লাস শেষ করে দিব?
জি স্যার, থ্যাংক ইউ স্যার, আসসালামু আলাইকুম।
ওয়েলকাম।
স্যার ইন্দারবার সিং এর ওই ছবিটার জন্য ধন্যবাদ।
আচ্ছা ঠিক আছে, আমি তো পাঠিয়ে দিব, সবটাই আমি পাঠিয়ে দিব ইনশাআল্লাহ। হ্যাঁ আচ্ছা, দেখা হবে ইনশাআল্লাহ। আসসালামু আলাইকুম।
ওয়ালাইকুম আসসালাম।
আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম আসসালাম।
Sir, thank you.
ওয়েলকাম। হ্যাঁ ইনশাআল্লাহ। আসসালামু আলাইকুম।